In this video, we are going to talk about the healthcare system in the USA versus Europe. So, before starting the video, please like this video. Do subscribe and turn on the notification to our channel for future updates. The amount of money that people in the United States spend on medical care is significantly higher than what is spent in any other modern country. On the other hand, just 23% of them believe that they receive the finest possible care. This is in contrast to the average of 70% of satisfaction among EU citizens on the quality of their healthcare system. Let's look into this void, shall we? To begin, let's put together a starting pack for a healthcare system, which is a list of the components that are required to construct one. 1. Patients. 2. Medical professionals and the organizations that represent them. 3. Those who pay. To put it simply, the particulars and plans pertaining to healthcare systems in various countries are based on how these three are formed, who is represented in them, and how effective cooperation between them may be. The primary distinction between the United States and Europe is about who is responsible for paying for medical treatment. The subject of payment, which is a key component of the affordability and accessibility of healthcare services, is approached differently in Europe versus the United States. Universal healthcare systems in European countries. In Europe, every citizen has access to medical care. No matter how much money you make, you will always receive the same essential benefits from the healthcare systems in Europe, despite the fact that these systems all have different organizational structures for the interactions that take place between insurers, providers, and patients. This is done on the basis of free access, equality, and equity, and fairness. Therefore, the following types of universal systems can be found in Europe. 1. A healthcare system with a single payer, in which either the government or the private sector pays the complete cost of health coverage, making the government or the private sector the primary insurer, while the healthcare provider sector is primarily comprised of private businesses. Patients don't have to spend much money on it, as a result of Spain's adoption of a single-payer healthcare system, which banned the phrase, spending money on healthcare. A system like this does not imply that the government would have complete control over everything. In addition to the funding provided by the government, there are private insurance companies that continue to provide coverage for the services of some private practitioners and for the additional coverage provided by hospitals. 2. A multi-payer system, in which there is public health insurance for persons whose incomes are lower than a specific threshold, and private health insurance for people whose incomes are higher than the threshold. Patients would not have to pay for medical care if they went through one of the government's designated healthcare providers. This construction coexists with private practitioners and insurance companies, and a physician may have a post in the government while also maintaining private practice hours. Patients are forced to seek coverage from commercial insurers or pay for treatments out of their own pockets because their government health insurance does not always cover all of the necessary components of their health plans. Germany uses a system with 2 tiers, similar to this one. There is a law that requires everyone to have insurance, and the insurance is provided by for-profit businesses that operate on a not-for-profit basis. There are 2 different kinds of health insurance, HI private and statutory, sometimes known as sickness funds. Statutory health insurance, SHI, PHI. The latter plan includes some more services, but otherwise the 2 plans are very similar to one another. Included in the scheme are those who are eligible for SHI but do not make more than €56,250 annually and their dependents who do not hold jobs. Those who have higher incomes or who are self-employed are the ones who get to select between these 2 options. Taxes and other contributions are the primary sources of funding. Therefore, the German system is composed of both the public and private sectors working together. As can be seen, universal healthcare systems in Europe are frequently constructed on the coexistence of private and government funding, which is kind of similar to what occurs in the United States of America. There is always a but, as the saying goes. Healthcare in the United States is a hybrid system. In contrast to Europe, not all people of the United States have access to insurance that is paid for by the government. However, monies from the government are made accessible to some Native American tribes, military families, and veterans. In addition, there is a national health insurance program known as Medicare that provides coverage for those who are over the age of 65, some people who have a disability status, and people who have end-stage renal disease or amyotrophic lateral sclerosis. In addition, there is a program called Medicaid that is jointly run by the federal government and the states that provides coverage for people who have low incomes. Adults are now eligible for Medicaid thanks to the implementation of the Affordable Care Act, but eligibility is contingent on passing income tests. This means that individuals, and sometimes senior citizens and children, who are supposed to be covered by Medicaid have to verify their eligibility to get insurance in order to receive coverage. Each state is responsible for determining its own Medicaid structure and administration, and if that structure is found to be in compliance with federal standards, the state is awarded the necessary financial and administrative resources. The Affordable Care Act, ACA, also had a provision that required individuals to have health insurance. However, this requirement was eliminated in 2017. The majority of healthcare costs in the United States are borne by the private sector, with consumers contributing 28% and private businesses contributing 20% of the total. The amount paid by state and local governments accounts for 17%, while the federal government contributes 28%. Even if they are paid for by the government, the vast majority of medical services are provided by private companies. What repercussions does this have for the operation of the system? It implies, first and foremost, that both healthcare providers and insurers are free to set their prices in whichever manner they see fit, without interference from the government. This would be a wonderful thing. For example, doctors get greater incomes in the United States of America than they do in Europe if it didn't imply that patients had to pay an incredible amount of money compared to other developed countries in order to maintain their health. So, that's it for today's video. What are your thoughts on our video? Please let us know in the comments section below. If you enjoyed this video and want to hear from me again, be sure to hit that subscribe button and turn on the notification to our channel before you go. Thank you so much for watching.